Endometriosis is a chronic inflammatory disease defined as the presence of endometrium-like tissue outside the uterus. Establishment and growth of such endometriotic tissue is estrogen-dependent, thus is mainly found in women in reproductive age. Endometriosis lesions are typically located in the pelvis, but can occur at multiple sites including the bowel, diaphragm, and pleural cavity. While endometriosis is a benign process, ectopic endometrium-like tissue and resultant inflammation can cause pain symptoms such as pain associated with menstrual cycle, named dysmenorrhea, dyspareunia, which means painful sexual intercourse, pain associated with defecation, called dyschezia, or while urinating, called dysuria, chronic abdominal pain, and infertility. Symptoms can range from mild to severely debilitating with consequent reduction of women's quality of life. Endometriosis lesion can be categorized as superficial peritoneal, ovarian, and deep infiltrating endometriosis. Superficial endometriosis occurs when endometrium-like tissue superficially involves the peritoneum. Ovarian endometriosis occurs when endometrium-like tissue forms an ovarian cyst. This ectopic tissue within the ovary bleeds, resulting in an hematoma surrounded by duplicated ovarian parenchyma. Ovarian cysts typically have fibrotic walls and surface adhesions and are filled with chocolate-colored content. Deep infiltrating endometriosis is defined as endometrium-like tissue extending under the peritoneal surface. This kind of endometriosis commonly affects the rectum, the rectovaginal septum, the rectosigmoid colon, the bladder, the parametrium, the ureter, and the uterine ligament and the vagina. Endometriosis globally affects about 10 to 15% of reproductive age women. However, determining the exact prevalence of the disease is challenging, especially in teen patients, because some women are asymptomatic and those with symptoms can have non-specific or atypical clinical presentations. The prevalence of endometriosis is much higher in women with infertility, about 50%, and in women suffering from chronic pelvic pain, about 70%. As for adolescent years, endometriosis can be detected in 25 to 38% of teens with chronic pelvic pain, in 49 to 75% of adolescents who do not respond to conventional medical therapy for pelvic pain, and in about 40% of teens with genital tract anomalies. Over 60% of adult women affected by endometriosis reported that the pain symptoms developed before the age of 20 years old.
The pathogenesis of endometriosis remains controversial, with three popular theories dominating the literature: retrograde menstruation, coelomic metaplasia, and vascular and lymphatic dissemination. The theory about retrograde menstruation is well known as Sampson theory, described for the first time in 1925. The main idea of it is that menstrual blood containing endometrial cell regurgitate via patent fallopian tubes into the peritoneal cavity, where the implantation of this cell might occur. The problem of this theory is that retrograde menstruation might explain ovarian and superficial peritoneal endometriosis, but not deep infiltrating endometriosis or lesions outside the peritoneal cavity. Metaplasia is the process by which a commit cell type transdifferentiates into an alternative cell type, example endometrial epithelium. This phenomenon may explain the genesis of deep infiltrating endometriosis. The lymphatic dissemination theory assumes that a small amount of the endometrial tissue can be disseminated through the uterine draining lymph vessel during menstruation. Endometriosis is an estrogen-dependent disease. Studies report higher level of estradiol and abnormal expression of enzymes, which can lead to increased estrogen concentration, inducing the synthesis of inflammatory cytokines, prostaglandins, and causing progesterone resistance. Inflammation is one of the main mechanisms that take part in the pathogenesis of the disease. In case of endometriosis, pro-inflammatory pathways block functions of apoptotic mechanism, and these mediators play a central role in disease pathophysiology as well as clinical sequelae of pain and infertility. Genetic susceptibility and alteration of immunity are also suspected to be involved in the etiology of endometriosis. Acquired genomic alteration represent a potential source for a conferred survival advantage to endometrial cell in the establishment of endometriotic implants. The hypothesis of an immune system dysregulation in women with endometriosis is supported by the frequent association with autoimmune and atopic disease. It is clear that the pathogenesis of endometriosis is complex and involves many factors and processes which occur simultaneously. There are multiple interactions of the immune system, hormones, genes, local and stem cells involved with a possible impact on endometriosis development.